Nurse Aide Practice Test PDF. Question 1. If the nurse aide observes a change in a client's condition, the aide should: Option A, document it in the chart. Option B, report it to the nurse immediately. Option C, wait to see if it gets better. Option D, ask the client's family what to do. The correct answer is option B. Report it to the nurse immediately. Changes in a client's condition must be reported to the nurse immediately for assessment and intervention. Documentation can follow, but reporting is the priority. Waiting could allow a serious condition to worsen. Question 2. When should a nursing assistant perform hand hygiene? Option A, before touching a client. Option B, after removing gloves. Option C, after touching client surroundings. Option D, all of the above. The correct answer is option D, all of the above. The CDC's 5 moments for hand hygiene include: before touching a client, before clean/aseptic procedures, after body fluid exposure, after touching a client, and after touching client surroundings. Removing gloves does not substitute for hand hygiene. Question 3. When dressing a client with a weak right arm, the nurse aide should: Option A, dress the right arm first. Option B, dress the left arm first. Option C, dress both arms simultaneously. Option D, dress the stronger arm first. The correct answer is option B, dress the left arm first. Dress the stronger arm, left, first, then the weaker arm, right. This minimizes discomfort and strain on the weak arm. Dressing the weak arm first would require moving it more. Question 4. Restorative care focuses on: Option A, curing the disease. Option B, maintaining and improving function. Option C, providing end-of-life care. Option D, replacing the client's abilities. The correct answer is option B, maintaining and improving function. Restorative care aims to maintain and improve the client's functional abilities, promoting independence and quality of life. It is not focused on curing disease or replacing abilities. Question 5. The nurse aide should report which change in a client's vital signs? Option A, pulse increasing from 72 to 76. Option B, blood pressure increasing from 118/76 to 126/82. Option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. Option D, respirations decreasing from 16 to 14. The correct answer is option C, temperature increasing from 98.6 degrees Fahrenheit to 101.4 degrees Fahrenheit. A temperature increase to 101.4 degrees Fahrenheit indicates fever and requires reporting. Minor variations in pulse, 72 to 76, blood pressure, 118/76 to 126/82, and respirations, 16 to 14, are within normal ranges and may not require immediate reporting unless accompanied by symptoms. Question 6. What is the first sound heard through the stethoscope when taking blood pressure? Option A, diastolic pressure. Option B, systolic pressure. Option C, pulse pressure. Option D, pulse deficit. The correct answer is option B, systolic pressure. The first Korokov sound heard is the systolic pressure. This is the pressure when the heart contracts. The diastolic is the last sound heard. Question 7. A client becomes upset and tearful while discussing their recent diagnosis. The nurse aide should: Option A, change the subject to something more positive. Option B, tell the client to stop crying. Option C, sit with the client and allow them to express their feelings. Option D, leave the room to give the client privacy. The correct answer is option C, sit with the client and allow them to express their feelings. Allowing the client to express emotions and providing a supportive presence validates their feelings and helps them process difficult information. Changing the subject dismisses their feelings. Telling them to stop crying is insensitive. Question 8. A client with dementia is eating slowly and forgets to chew. The nurse aide should: Option A, feed the client quickly. Option B, provide verbal cues to chew and swallow. Option C, puree all food. Option D. Remove the food after 15 minutes. The correct answer is option B. Provide verbal cues to chew and swallow. Verbal cues, example, chew your food, help the client eat safely. Rushing increases choking risk. Pureeing may be necessary for some but not all. Removing food after a short time may result in inadequate nutrition. Question 9. A client is withdrawn and refuses to participate in activities. The nurse aide should: Option A. Force the client to participate. Option B. Allow the client to choose and respect their decision. Option C. Leave the client alone. Option D. Tell the client they must participate. The correct answer is option B. Allow the client to choose and respect their decision. Respecting the client's autonomy is essential. Forcing participation can increase withdrawal and anxiety. Leaving them alone may increase isolation. Offering options and allowing choice is the most therapeutic approach. Question 10. Which position is best for taking a rectal temperature? Option A. Fowler's position. Option B. Dorsal recumbent. Option C. Sims position. Option D. Supine position. The correct answer is option C. Sims position. Sims position, lying on left side with right knee flexed, provides the best access to the rectum and is most comfortable for the client during a rectal temperature. Fowler's is a semi-sitting position. Dorsal recumbent is used for pelvic exams. Supine is flat on the back. Question 11. What is considered a normal blood pressure for an adult? Option A. 90/60 mmHg. Option B. 110/70 mmHg. Option C. 130/90 mmHg. Option D. 140/100 mmHg. The correct answer is option B. 110/70 mmHg. Normal blood pressure is less than 120/80 mmHg. 110/70 falls within the normal range. 90/60 is low, hypotension. 130/90 and 140/100 are elevated and indicate hypertension requiring medical attention. Question 12. A client with dementia has a tendency to wander. The nurse aide should: Option A. Place the client in a locked room. Option B. Provide a safe wandering area. Option C. Use restraints. Option D. Ignore the behavior. The correct answer is option B. Provide a safe wandering area. A safe, enclosed area for walking addresses the need to wander safely. Locked rooms and restraints are restrictive and require orders. Ignoring the behavior is unsafe. Question 13. The nurse aide is performing perineal care on a female client. The aide should: Option A. Wipe from front to back. Option B. Wipe from back to front. Option C. Wipe in circular motions. Option D. Wipe in any direction. The correct answer is option A. Wipe from front to back. For females, wipe front to back, vagina to rectum, to prevent introducing fecal bacteria into the urethra or vagina. Back to front increases infection risk. Question 14. Which task is outside the nurse aide's scope of practice? Option A. Applying a gait belt. Option B. Recording output. Option C. Changing a sterile dressing. Option D. Offering a bedpan. The correct answer is option C. Changing a sterile dressing. Sterile dressing changes require sterile technique and are outside the nurse aide's scope. Applying a gait belt, recording output, and offering a bedpan are within the nurse aide's scope. Question 15. What should the nurse aide do first for a client who has fallen? Option A. Move the client to their bed. Option B. Assess for injury and call for help. Option C. Document the fall. Option D. Call the client's family. The correct answer is option B. Assess for injury and call for help. Assess for injury while calling for help. Moving without assessing could worsen injuries. Documentation and family notification are secondary. Question 16. A client with depression refuses to get out of bed. The nurse aide should: Option A. Allow the client to stay in bed. Option B. Gently encourage the client to get up. Option C. Force the client to get up. Option D. Call the family to get them up. The correct answer is option B. Gently encourage the client to get up. Gentle encouragement with support and assistance can help the client participate in care. Allowing them to stay in bed may worsen depression. Forcing them is not appropriate. Family members should not be expected to manage care. Question 17. A client expresses fear about an upcoming procedure. The nurse aide should: option A, tell the client not to worry. Option B, acknowledge the fear and offer support. Option C, change the subject. Option D, tell the client the procedure is minor. The correct answer is option B. Acknowledge the fear and offer support. Acknowledging and validating the client's fear provides emotional support. Dismissing or minimizing the fear, A, D, is not therapeutic. Changing the subject, C, avoids the client's concern. Question 18. When applying gloves, the nurse aide should: option A, wear gloves that fit loosely. Option B, pull gloves over the cuffs of the gown. Option C, wear gloves only for blood exposure. Option D, reuse gloves to save supplies. The correct answer is option B. Pull gloves over the cuffs of the gown. Pulling gloves over gown cuffs creates a barrier preventing wrist and arm contamination. Loose-fitting gloves increase the risk of tears. Reusing gloves is never acceptable. Question 19. How long should a nurse aide rub hands together with soap and water during hand washing? Option A, 10 to 15 seconds. Option B, at least 20 seconds. Option C, 30 to 40 seconds. Option D, 1 minute. The correct answer is option B, at least 20 seconds. According to CDC guidelines, hand washing requires at least 20 seconds of vigorous rubbing to remove transient microorganisms. 10 to 15 seconds is insufficient. A full minute is not required for standard hand washing. Question 20. The nurse aide should document care. Option A, at the end of the shift. Option B, as soon as it is completed. Option C, before providing care. Option D, only if the client's condition changes. The correct answer is option B, as soon as it is completed. Documentation should occur as soon as possible to ensure accuracy and prevent forgetting details. Delaying to the end of the shift may lead to memory errors. Question 21. A client who is confused becomes agitated. The nurse aide should: option A, give the client a sedative. Option B, remove the client from the situation. Option C, use a calm, reassuring voice. Option D, tell the client to calm down. The correct answer is option C, use a calm, reassuring voice. A calm, reassuring voice can de-escalate agitation. Sedatives require an order. Removing the client may be necessary if they are a danger to self or others. Telling someone to calm down often has the opposite effect. Question 22. When giving a bed bath, water temperature should be approximately: option A, 90 to 95 degrees Fahrenheit. Option B, 100 to 105 degrees Fahrenheit. Option C, 110 to 115 degrees Fahrenheit. Option D, 120 to 125 degrees Fahrenheit. The correct answer is option B, 100 to 105 degrees Fahrenheit. Water for a bed bath should be 100 to 105 degrees Fahrenheit, about 37.8 to 40.6 degrees Celsius. This temperature is comfortable and does not burn. 110 to 115 degrees Fahrenheit can scald sensitive or elderly skin. 120 to 125 degrees Fahrenheit can cause burns. Question 23. What should the nurse aide do if a client's oxygen saturation drops to 90%? Option A, increase the oxygen flow. Option B, report it to the nurse immediately. Option C, reposition the pulse oximeter probe. Option D, document the reading. The correct answer is option B, report it to the nurse immediately. An SpO2 of 90% is below normal, 95 to 100%, and requires immediate reporting. CNAs cannot adjust oxygen. While repositioning the probe might be attempted, reporting to the nurse is the priority. Question 24. What should a nurse aide do if a client refuses isolation precautions? Option A, ignore the client's refusal. Option B, use restraints to keep the client in the room. Option C, educate the client and report to the nurse. Option D, discontinue isolation. The correct answer is option C, educate the client and report to the nurse. The nurse aide should explain the purpose of isolation and report refusal to the nurse. Restraints are never appropriate without a physician's order. Ignoring refusal or discontinuing isolation puts others at risk. Question 25. Which sign indicates a client may need toileting assistance? Option A, restlessness and picking at the sheets. Option B, closed eyes and slow breathing. Option C, smiling and laughing. Option D, sitting quietly in bed. The correct answer is option A, restlessness and picking at the sheets. Restlessness or agitation often indicates a need to use the bathroom, especially in clients who cannot verbally express this need. Offer toileting regularly.